Good evening, everyone. My name is Kay Tillow, and I'm welcoming all of you to this webinar by National Single Payer. Our organization is a grassroots organization that organizes locally and nationally in a struggle for national single-payer healthcare. We are united by the common principles that healthcare is a human right, that it must be free from profit, and that it must be achieved through national legislation, which we all have to work to make happen. If you would like to support our work, please donate to the organization. You can find that in the chat throughout this webinar, and there will be a link where you would be able to do that. And our guest speaker will speak for about 30 minutes, after which Dr. Judy Albert will ask the questions that have been posed in the Q&A. And I turn this now over to Ed Gristar.
Hey, thank you, Kay, for that introduction. And I am very excited about our speaker today. And one of the reasons that I am excited is that it brings back memories. And I was talking to my wife and Anna here before the presentation, and that I was in Cuba on the Venceremos Brigade in 1975. And so it kind of shows my age, but I have to say that in 1975, the transformation of Cuba was already forthcoming. The people were excited, there was energy. We worked for 6 weeks building daycare centers, and I thought to myself today, they were building daycare centers for their people 50 years ago. And today the US is in a quandary about how to take care of our youth. So that hopefully will lay the foundation for our webinar tonight, in which we also want to thank and since I'm from Pittsburgh, PA, I want to thank the Pittsburgh Matanzas Sister City Project, that our local single payer group in Western Pennsylvania had a great leader. It was a state senator, Jim Furlow, who unfortunately passed away a couple of years ago. He set up the Pittsburgh Matanzas Sister City Project, and today it's run by Lisa Valenti, and we work with them. And with that, I want to say that our speaker today is David Ramirez Alvarez. He was born in 1991 in Havana, Cuba. He has a BA in foreign languages from the University of Havana, did postgraduate diploma work in foreign affairs. He speaks 4 languages, Spanish, English, French, and Portuguese. And in 2018, he was an official in the Ministry of Foreign Affairs. He's a young man. He's about as old as my son. So he's occupying a very prestigious position. And he's also in 2018 and 2022, he was the attaché assigned to the United States Division in the Ministry of Foreign Affairs. In 2022, he was second secretary assigned to the Cuban Embassy in the United States. He's also married and has 1 son. I'm going to let him introduce his other associate speaker, Juliette Tain, and we're not sure her resume or her vita. But with that, I'm proud to say welcome, everybody, and I'll turn it over to David.
All right. Thank you so much for your introduction. It was very interesting. I had no idea you were in the Venceremos Brigade, which seems to have been just the other day ago. So congratulations for that. Yes, thank you for letting me know that Juliette, my colleague, is online. Juliette Tain, she's also a member of the Embassy of Cuba here in Washington, D.C. I think it will be very helpful if she also participates in our panel, because she will be helping us in enriching much information in regards to the Cuban healthcare system, medical system, since she has been working for around almost 10 years dealing with the healthcare sector, both in Cuba and now here in the United States, mainly in regards to what has to do with foreign affairs. So we think she will be a great help and a great participant in this event. She right now is part of the commercial office at the Embassy of Cuba, but has a lot to do with healthcare as well and biotechnology. And obviously, it would be amazing if you guys listen to her or when you listen to her. So thank you for that.
Thank you. Thank you for the invitation.
David, I think that this is Anna Malino, and I'm welcoming you and everyone to the webinar. I think that Juliet just spoke. I invite you to go ahead and continue talking about our webinar today, Against All Odds, what the U.S. can learn from the Cuban healthcare system. I'm really looking forward to it because one of the things that National Single Payer talks about is healthcare as a human right, and I know that that's the case in Cuba. It would be amazing to be able to copy the Cuban healthcare system here in the United States. We know that that's highly unlikely, but I'm sure, can use the Cuban healthcare system as an inspiration for what we could one day have here in the United States, especially as we look to other models of care, one where the US healthcare system is not owned by private corporations. So I do invite you to speak to the group about the healthcare system. And David or Juliet, whoever can answer those questions.
Okay, thank you very much, Anna. Very nice meeting you. I listened, virtually by Zoom. So yes, I think it will be, in order to start talking about Cuban healthcare system, Cuban medical care system, I think it would be very important to go to, do some sort of a historical background and, mention some and some conditions that brought us to today. As you all know, Cuba is a developing country, one of the southern countries in the world. We do not have great amounts of, resources. We don't have oil. We do not have, gold or silver or uranium or whatever the resources that countries which are very rich use to, enrich themselves. But we consider ourselves very rich in human resources. We consider ourselves to have one of the highest rates of medical physicians around the world. And this is the result of decades of investment, of public health investment on this. I just want to go back to one of the most important political manifestos in Cuba in the last century was a manifesto by our commander-in-chief Fidel Castro, who before the revolution, when he was in prison, political prison in Cuba, he redacted a manifesto which was called History Will Absolve Me. This was practically like a defense allegation when he was sent to trial for attacking the Moncada garrisons on July 26, 1953. And what was most interesting about this manifesto, it was that it was very specific and very statistical in detailing the hardships that our society went through in the 1950s. So he established a very interesting contrast in how, how rich and populous Havana used to be, with many foreign travelers going to casinos and living the life, whereas the rural life in Cuba was very hard. So he gave some interesting facts, like, for example, infant mortality in the period was 60 to 1,000. 60 born alive to 1,000 kids. This was incredibly the highest rate in Latin America at that period. But this rate was actually only in Havana. When you went to the rural areas, almost 90% of children were filled with diseases and parasites. You had to walk. I mean, the common citizen in rural areas had to walk around 100 miles to get to a mid-level physician to get just a treatment for anything that would happen to them. Um, in Havana, the rate was actually of doctors per 1,000 people was of one doctor per 1,000 people. It was the highest rate in the area at the period. Still, the rural area almost had no doctors. Public healthcare was basically inexistent. I mean, there were huge, luxurious hospitals, mainly in Havana, but in the rest of the country, there was no public healthcare, and mainly everything was private. But in 1959, after the revolution triumphed, there were around 6,050 doctors for a population of around 6 million people. That is a very low number for a population of 6 million people. And incredibly, on top of that, between 1969 and 1962, more than 2,000 physicians and doctors left the country because of transcendental transformations that the government in power was taking in the medical system, which was basing most from a private-based form of system to a more broad system that supported subsidies in all sorts of commodities, even selling pharmaceutical goods. From that moment onwards, the transformation became radical. The revolution started different programs and projects from day one. There was a social service which was called Servicio Médico Social Rural, which in translation would be Social Medical Rural Service, which the graduated doctors who actually graduated and some of them volunteered to go to rural areas gave for the first time medical treatment to hundreds of thousands of people in the countryside, in the mountains, mainly in the eastern side of the country. This was very important because these people at the same time created the basis, the foundations for what in the future we would call family clinics and later on polyclinics, and we will be talking about that later on. Um, Starting from 1959, we started the creation of medical schools in the countryside, polyclinics, hospitals, and established what we now call a comprehensive primary universal healthcare system based mainly on prevention. In 1963, we started mass immunization program that led to the eradication of polio. In 1964, the first batch of 250 physicians who were fully educated within the revolution had graduated from Havana University, which at the moment was the only university that graduated students from the medical sector. In the 1970s, we eradicated malaria. In 1979, we reached the lowest infant mortality rate in Latin America with 29.6 per 1,000 born alive. In 1983, we created a program which was called PAMI, which is still existing today and still a very broad program in our country, which would be called a parental maternal integral program, which is a huge scaffolding of assistance and social help for different mothers and children that go from subsidizing their salaries and pay leave to going to specific consultations at the hospitals to take care of children and mothers. This was essential to the radical reduction of both maternal and infant mortality rate. I do not want to talk for too much. I know we have only 30 minutes, so I'm going to start talking much faster. In 1998, we created what now we call ELAM, which is the International School of Medicine, which is something that has been transcendental. I don't think only in the hemisphere, but worldwide. It was a school that was created solely to graduate students from southern countries, from underdeveloped countries, with the main objective of helping the common people in poor communities and struggling communities. To the date, we have 30,000 doctors that have graduated from 122 countries. Um, Even from the US, there are more than 40 students that have graduated. We can say that Cuba today has 4 higher institutes of medicine, 23 schools, or we call it faculties of medicine, 23 research institutes, 84.1 doctors per capita, which means that we are the #1 country in the world to have more doctors per capita, followed only by Monaco and Sweden. Interesting fact, we also have the highest rate of dentists per capita in the world. In 1959, Cuba had 1 rural hospital. Today we have 64. Today we have 150 hospitals, 436 polyclinics, more than 15,000 family clinics scattered all around the country. This brings me to what we call internationalism. For our society, for our way of living, for our political and social system, internationalism is a key component to what we do and to what we live for. For us, solidarity is very important, and sharing what we have with the whole world, whomever needs it, is very important. We have also a history of international medical brigades that go back to 1962, from an earthquake that struck Chile, which was very deadly. We would say that the first international brigade that we sent from Cuba to some other country was this one in 1962, but we also sent medical brigades to countries that were fighting colonialism, like Algeria, Namibia, Angola, other countries, etc. We created the Henry Reeve Brigade during the Hurricane Katrina, when it struck Louisiana, mainly New Orleans. We created a group, a brigade that was, from day one prepared to go to the United States to help the people of the New Orleans from the terrible disaster, natural disaster that struck that country. Unfortunately, the U.S. government in that period did not accept our help. But this medical brigade, Henry Reed Brigade, has done wonderful work all around the world, free of charge. They've gone to Pakistan. After the hurricane in Pakistan, they have gone to Indonesia after the tsunami in Indonesia, and they have gone to Bolivia. They've gone to Haiti. So it's a beautiful history of help. And I do not want to end without talking about the COVID pandemic. The first year of the COVID pandemic, we sent 57 brigades around the world, treating around 1.3 million people in 40 countries, even in Europe. In the hardest situation that Italy was going through, the Cuban doctors were there. We helped the Italian population to get through the COVID pandemic, the Andorra population also in Europe, and obviously in Latin America, in Asia, Africa, and the Middle East. I think we could, keep talking. Most probably during the Q&A we could discuss more issues, but now I want to give the word to my colleague Juliet, who is going to give very interesting examples of how Cuba healthcare system works. So thank you.
Thank you. I don't know if we have more time, or you prefer start with the question and I can explain more examples with the question, because I know that you give us 30 minutes and David explained a lot of the important things on our health care system. So if you prefer to start with the question, I can explain more details after the question. No? Okay. I just want to read that our base of the healthcare system is the prevention and the work with the community. David talked about the family doctor, and we've seen that they have a very special role in our system because they take care of all our prevention programs. And that means the programs for the diabetics, for example, or the program for the take care of the children, or our pregnant woman, that is the program that Pamela that David talked about. And that is really important in moments for the viral disease or a pandemic situation, for example, COVID-19, because they have all the details of the universe community, that is the name that we use, and that means the a specific problem in the community where there are the vulnerability of the people, or where there is the principal programs. And that permit that our Ministry of Health take the decision that where hospitals need more support, or where area of the country need more support at the moment, in this moment, like COVID-19, for example. That was a moment that unfortunately we have to implement these protocols. And also there is our biotech industry that work in dependence of the necessity of the country for the medicines and for all drugs. We have right now a critical situation with the raw materials, because there is really complicated to buy the raw materials for the medicine that we need. But before 2 or 3 years after the pandemic, we produce almost the 70% of the medicine that we use. So this is a huge system that works for the people, for the Cuban people, and they focus in the principal program of health, and that is our principal program.
Okay, maybe we'll have Judy, who's going to be asking questions, ask questions from the Q&A, and then we also have some other questions as well.
Okay, great. Well, thank you both for those remarks that are enlightening and go back some time in history and through a lot of development. And that's what some of the questions are posed. So, for example, there was a question asking if you could elaborate on what the most difficult resistance was encountered in developing the current Cuban healthcare system. Historically, I think, is what the questioner was interested in.
Okay, so that's a very good question. I think the most the resistance that was encountered in the period, I imagine it would have been from 1959 to 1962. It was a moment of a lot of change in our country, of radical change. We went from having a practically inexistent public health system to having a very structured and very strong public healthcare system. As my colleague Juliet was explaining, right now the healthcare system in Cuba, its main objective is prevention. Its main source of work, its main, you would say, scaffolding for achieving our national health goals, is through prevention. And obviously the doctors that, the traditional doctors in Cuba, what they used to do was just treating diseases, specific diseases, mainly diseases that were very, in a developed stage, because there were so little doctors and not enough of them to take care of, most of the population. So one of those resistance that was found was, changing the structure of how the medical system in Cuba was, from curing, from treating, which we still do, to having this principle, which is preventing from stage one. And that's why we are very keen on what is called primary healthcare system, where you have doctors that live in family clinics, as you would call them, which is mainly one family clinic per a block or per 2 blocks, and they take care of the population, and they know the people of the population. But my colleague Julia can expand on that. And the other reason that I think could have been used as a resistance was that changing of the system from mainly private institutionalized system of healthcare to a more broadly subsidized system, obviously had an impact on the you would say the income of specific doctors, very rich doctors in the pre-revolution period, and obviously that had an effect on them. There was a transitional moment where up until the 1980s we had like a mixture of small private doctors, practitioners, and the public health system. But at the end of the day, the public health system uh, managed to to guarantee the healthcare for all, and basically these small private practitioners ceased to exist.
Julian, do you want to go ahead and expand on that?
Yes, I want to talk about some questions about this family doctor and our polyclinics, because I saw some question about that. As David explained you, there are a lot of programs. For example, they talk about the pregnancy program. Imagine that this doctor take care all the pregnant women of these 2 or 3 blocks that depend on the area, of the population area. And she or he saw every week to this pregnant woman, and after, and then this kid until 6 year, almost 1 time for a month. So she or he doctor have to take care of these vaccines or this test or every symptom that they have in all this process. And that is supervised by the polyclinic. That is the name of it's like a mini hospital that we have in our communities for first attention that the people need. And also at the same time, the Ministry of Health take care of all these programs in the different areas that we have. So that is an example, because at the same time, this doctor for the community have to take care for the diabetic people in the same way. For example, for the people that are illness with cancer. And if he or she, if this doctor decide that the patient have any other necessity for a specialist doctor, they recommend it for the specialist hospital with the all history of the attention that they need. So it's really good for this doctor or a specialization doctor, I don't know what is the specific name, because they receive the patient with the history of our doctor family that explain what is the community, what is the principal problem in the community, what is the trajectory of this illness, and all the information that the doctor need for a better decision for this patient. So this is the importance of the role of our doctor, family doctor, or the polyclinic too, because they work with the community. They work with the schools in the community and with the other entities that are not only for the families, because if there are, for example, an enterprise, they take care for these people too, because they are part of the community most of the time of the day. Okay.
So that kind of explains that there's a great deal of continuity from birth through all stages of life. And one of the questions is how do the community clinics work? Is that all based in a clinic setting, or is it in a home setting, neighborhood setting?
That depends on the area, because the program have the similar situation of the community. If The rural community is different at the center of the city, but it's the same base for all clinical communities. That is similar to the polyclinic. We name the clinical community to the polyclinical, but the polyclinical have some family doctors at the same time.
Okay. One question that's an important question is whether there's a public health professional, student and/or professional specialty that helps to shape the healthcare system in Cuba. How would that work, and how does it influence the service in the system?
Yeah, that's a great question. I think the best way to answer is that the students, the medical students, the best way that they have to learn is going to the polyclinics and to the clinics, and learning from the direct exchange that doctors, graduated doctors, experienced physicians have with the public. That's how that with the population. That's more or less how it works in Cuba. I mean, there are residencies that are also established after you graduate from medical school. Medical school is actually one of the longest, you would say, majors to studying in university in Cuba. For example, right now the medium years that we study university takes like around 4 years, but medical school takes around 5 to 6 years, and they take a long time studying. And I think starting the 4th year, more or less, they start also doing, specific procedures. And obviously there are different, different studies that you can do, general medical practice and specific majors. But basically what is mostly done in Cuba is to, start going to hospitals, polyclinics, doing shifts, night shifts, helping doctors, from the first year you start studying. I don't know if that answers your question.
I wonder if maybe you could also talk to the infrastructure that directs the placement in these rural and urban communities. Is there a way of distributing the medical care that comes through some kind of government infrastructure?
The community healthcare work with the Ministry of Health, so that they are part of the same system.
Mm-hmm. Okay.
Yes.
So there were a number of questions about how Cuba has made advancements in the treatment of various cancers, and how Cuba has managed to deliver medical care under the embargoes that the U.S. has enacted with drugs and other technologies. Maybe that you could address that.
Okay. I was talking about our enterprise, our system of biotech that is really important for Cuba, because we in some time could produce more than 70% of our medicines, and that is important because all people can access for these medicines to a different price. But also this enterprise developed a lot of drugs. For example, for cancer, we have a vaccine against the lung cancer that right now we have a joint venture with Roswell Park Center from New York, and they are working together for develop these important vaccines for the people that have lung cancer. They are in the trials, but there are really good results of this. Also, there are different drugs, for example, Everprop P, that are for people that have diabetic foot. This is a drug that Cuba exports to other countries. Unfortunately, we can't do it for US because of the blockade. We would like to have some collaboration with different institutions for develop this ever brought peace for the U.S. citizens, because we know about the problems that have the people of U.S. for diabetes. But the blockade also impact in Cuba for the for the way that we buy the raw materials for develop all these medicines, because we need to buy this in other countries, and the blockade is not only for U.S. Enterprise or pharmaceuticals, it's also for other countries, and that is a huge obstacle. And also the inclusion of Cuba in the list of state sponsors of terrorists is another situation, because that not allow the transactions, the financial transaction, to pay this raw material. So sometimes we have the people that want to buy to sell Cuba this raw material, but we can pay for that because of this. So with the question about how impact, imagine all this system without a blockade and without the inclusion of Cuba in this list. We could develop a lot of medicines, not only for Cuba, I think, and we could have more collaboration about these protocols that they are really, really good for the community people, not only for Cuba, I think. So we are really impacted for the blockade and for the other actions against Cuba, because we can develop all the medicines that we need. We can have access to the machines that we need, because Cuba can buy any machine that have more than 10% of products from US. So that is another problem to obtain, I don't know, a machine for against some test for cancer or some test for a specific illness. So it's really complicated. We also develop some vaccines, because we can buy these vaccines in other parts of the world. So it's critical impact. It's a critical impact for our healthcare system. Any action against Cuba and against our doctors.
Mm-hmm.
But we are still push for our system.
It seems amazing that the advances that Cuba has made under these circumstances, because it touches every aspect about production and, the machines, as you indicated. And is there some financial benefit to being able to sell any of the technologies to other countries, or is that not possible?
We have collaboration with a lot of countries, because this is a really important area for us, health and biotech and different other areas. But the financial for all the system, we don't receive that. We have collaboration in specific areas and in specific medicines, and they develop for some kind of vaccines, but not for all the system.
Mm-hmm. There are a number of questions about how does treatment of mental health issues and long-term care for the elderly and disabled people. If you could elaborate on how that is handled in Cuba.
I wanted to I was reading some questions, and there are several questions on how do as the Cuban government pay doctors, and if it's based through taxes, and the answer is simple. Every year, the national budget of Cuba, 73% of the national budget of Cuba is allocated to social services and social goods. Within those social services is healthcare. Healthcare comprises like more than half of this 73%. Is what we mainly invest on, and where we mainly put our budget on, because it's a circular sort of financial allocation, and obviously the income we have through international cooperation has a direct circular effect towards the development of the healthcare system. So yeah, basically the answer is that our budget of healthcare system is mainly based on the amount of money that we put on our national budget. So just wanted to ask that question, answer that question.
Okay. And would one of you be able to answer the question about care for mental health issues, long-term disability, and for seniors, the elderly?
We have different programs for this also. We have our biotech industry are developed medicine that the name is NeuroEpo, and that is specific for these mental health issues like Alzheimer, for example. We are in the test right now, but there are really good results. The elderly people, we have a huge program. I think that it's not only for the healthcare system. The healthcare system is part of this society program. That is our because we take care a lot of our elderly people. It's really important the mental health issues, but also the diabetic and other issues that is normal at this age. So yes, the principal programs is for the family doctors. They take care from the community, and if necessary, they put in to other specialists in the hospitals.
And so is aging in place the usual way that elder care would be delivered, as opposed to in the United States, it's very common for the elderly and disabled to live in a nursing home situation?
Yes, it's the same. For example, our family doctor have a nurse, and both have a day in a week to go door to door. Is the name that I saw in some ask for the people that have some kind of problem, and they can go to the house of the family doctor, to the small consultory. Mm-hmm. So they have a day in a week, not only for elderly people, also for people that can can go to the consult, like pregnancy women or some other illness people. So yes, and also in the pharmacy have this program for delivery the medicine that they need.
And are there hospitals or nursing type homes for people that can't be cared for at home, or is it generally not done that way? For an elderly person that needs a lot of direct care throughout the day, is that a family member that's usually doing that if they can't take care of their yes, daily needs? Okay.
Most of the time it's the family member, a family doctor, not family member, family doctor, that they support all the needs that the family members of this person have.
And are you aware of how significant a problem there is in Cuba with mental health issues, particularly depression, anxiety, and addiction, as we are experiencing a huge problem with that in the United States?
I don't have the numbers, mm-hmm. but we have another huge programs against the drugs and addictions. Mm-hmm. Our principal objective in these programs is the young people, of course. And in this huge program work the healthcare system, and all other areas that are need to support this program. But yes, it's really important for us. We take care for the schools, and because we are part of the World Corps, but it's right now it's not a huge problem in our country. I don't have numbers for that question, but I know the drugs is controlled right now.
I'm sorry, it is a huge program or it is not?
No, it's not. It's not a huge program.
Okay. And a number of other questions about maternal and infant mortality, what the rates are, and what are the rates, or what are the rates of mortality from chronic illnesses and life expectancy in Cuba, if you have any numbers about that.
Yeah, we mentioned before that the infant mortality rate in 2023 went down to 7.1 per 1,000. Actually, this number spiked, unfortunately, during the pandemic. And after 2 very difficult years, we're getting back on track because the the lowest number that we had of infant mortality rate was around 4.8, 4.9 per 1,000, which was very good. But we also have managed to achieve one of the lowest mortality rates for mothers, for just I don't know how you say it in English, but for mothers who have just given birth. Um, in fact, there are provinces in Cuba that have gone decades without one single mortality in this issue, and it's actually a successful experience. And we have also managed to eliminate the transmission of mother to child syphilis, and we are on the verge of eliminating the transmission of HIV/AIDS as a whole. Also, HIV has been the transmission has managed to eliminate from mother to child as well. Um, yeah, we have very we could say that our rates are very good, comparable to first world countries.
Mm-hmm. Yes, the congenital syphilis rate in the United States has been going up steadily. We're not eliminating that here. Let's see. There was a question that I thought was interesting about Pramila Jayapal, who is planning a visit to Cuba, and she is against the blockade and the statement that Cuba is a terrorist state. And the person who asked the question is one of her constituents and suggested that she visit Elam, and he was wondering if the delegation or the Cuban host could make sure that she visits the school or one of the schools of Elam.
So this could be a good opportunity to invite all of the 133 current participants of this Zoom meeting to visit Cuba. I think it would be great if if you experience firsthand the Cuban healthcare system, and I think it will be a fruitful opportunity for you to learn about our country, to learn about. There's a guy saying a field trip. Yeah, if you want to generate a field trip, let's start talking about a field trip. It would be great if you guys visit our country, go to our medical institutions, visit the family clinics, visit the polyclinics, visit the schools, and just get a broader sense of what our healthcare system is like, because there's nothing better than seeing what we're talking about from your own eyes, right? So yeah, to answer your question, we will always be open to politically and diplomatically to give access to every foreign official or foreign member of government to visit our medical institutions.
I think you probably may have 131 people that are going to be at your doorstep soon who want to go. So we do have quite a few other questions. I'd like to try to get to one of the things that we're struggling with in the United States is the disparities in healthcare across different populations. We call it the social determinants of health, and it has to do with racial inequities, socioeconomic inequities, and I'm wondering if you could talk about how that works or doesn't occur in Cuba? Are you seeing disparities and differences in how people are cared for or how well they respond to their care as a result of differences in the population?
No, the access to the healthcare is universal. David talked about this. That is in our constitution. So there is any discrimination about anything. And that is the principal base of our healthcare, that every Cuban is safe with the healthcare system. We have other necessities with the machines and the medicines and the specific treatment necessities that the hospital has, but not in the attention of the patients. That is not a problem.
Interesting. Are there, is there an awareness? I mean, I'm sure.
I wanted
No,
to
go ahead,
elaborate on
David.
that. Yes, I wanted to elaborate on that as well. The issue is that, you know, it's a different way of seeing I mean, life and the healthcare system in Cuba. It's very normal. It's very common to, you know, knock the door of your community doctor, who is probably, you know, on your next door, and just tell the doctor, I have this pain over here, I have this pain over here, I have a fever. Can you please help me out? Can you please tell me what's going on? And you know, it's more of a familiar sort of attention. So in this way, this, you know, somehow that destroys all sorts of, you know, discrimination, the inequalities, disparities, because, you know, it's provided to you firsthand on a free and universal basis. So from just, you know, getting a prescription to getting a heart transplant, it will always be universal, and there will be no discrimination, which is actually punishable by law.
There was a question, since you mentioned a heart transplant, there was a question about how long people might wait for certain surgeries. The example that was given was to have a knee replacement, but also you could ask that about a transplant surgery. Is there a long wait for those very specialized treatments? And how is it managed?
I don't have the exact time that they have to wait. Sometimes depend of the access that we have to the medicines or specific necessity that people have, because sometimes we need to wait for a specific medicine on a specific machine for some this complicated surgery, but that depends of the necessity of the people and the urgency that they have. The kids in Cuba is the most important people, of course, and then depend of the medic decision, of course. I don't have the time, but I know that there are urgency for the most necessity person, like kids or elderly people or people really illness for this kind of specific surgery.
There was a question that was asked about related to diet. How are food substances and additives evaluated and permitted or banned in Cuba? I mean, we would look at diet as being a huge component of the preventive medicine. And is that something that the family doctors and family clinics are able to influence, the type of diet that people are eating to be in the best health?
They have programs in the schools of the community. They have programs for the mothers and the fathers that take care of the diet with the children. But also, because of the blockade, we produce a lot of organic food because we don't have access for the this kind of chemic or that is necessary for increase the production, of course, but we don't have access. So most of the food that we produce is organic, that is really good for health. And the problem that we have with the food is the critical situation that we have right now in Cuba. We have to buy a lot of food because we don't have the necessary production. And sometimes that is not incorporated with this program for preventions that we have in the schools and we have with the parents. But we try to educate the people, the Cuban people, to have a health diet in this way.
There's a number of questions about the international physicians that go all over the world, as David mentioned, and people are wondering if they're paid. Also, how is it possible to send so many volunteers to other countries, and why it's a priority? I think David kind of touched on this. It goes back to the Constitution, but if you would like to elaborate on that a little bit, on the International Doctor Program.
Yeah, the issue is that there are two different categories. There is international services, medical services that we provide, which are paid for, and there are contracts, international contracts that are based directly with the Ministry of Healthcare. And at the same time, in parallel, there are medical brigades which pays for specific necessities that are allocated to Africa, to needed countries that are going through crisis, countries that are going through a natural disaster. So many of them are provided by free of cost by our country. Sometimes it's a collaboratory effort with the other state, but obviously that it depends on the specific case, on the specific program, and on the specific brigade. So I don't know if there is some other question that you wanted to clarify on that.
Well, and I think another question that we're all interested in would be if you're aware of what happens to. I know this is a different issue than the brigades, but the U.S. students that are trained through ELAM, and then come back to the U.S. Are you aware of how they fare in whether they're able to engage in promoting public health of Cuba here? Do you have ongoing contact with them? We wondered if they would be interested in working with us to try to establish a universal health care, if you know anything about those students.
We have contact with most of them. We try that they come back to the communities for promote the take care of these communities in the way that we show that we have our protocols in Cuba for this primary health care with this protocol for prevention. And then they have to apply for the test that they need to have here in US. And we continue with some kind of program to have this connection, to try today all the time come back to their communities and service for people that have real necessity for the healthcare.
And I think you may have said this earlier, maybe David said it, how many of the ELAM trainees are accepted and come from the United States every year?
I don't know the exactly number. I know that right now we have 5 or 6 in the finish terms of the career. We hope that they come back to their communities and they start their work as soon as possible.
Mm-hmm. And they're eligible to get a medical license in the United States and practice medicine here.
Yes, they have to do it, the test. We will give the support that they need for this test, for the preparation. And then they apply to other to the hospital or clinic or their community if they need. It's their decision. Here there are an organization. The name is Medic. They have a real relation with these doctors, and also yes, Pastor for Peace have the. Sorry, I'm trying to read the question. Yes, both organizations work with this doctor from the LAM, and they support, like us, all the process that they need for approve the test that they have to get here in US, and then they work in the communities.
Some of the participants posted more information about the Latin American School of Medicine application deadline, and I think somebody posted something in the chat. I just saw it go through about. I know there's a video about 4 of the students and their experience, which people will be able to see. And one thing that might be interesting for us is if we would ever be able to reach out as a group, our national single payer group, to those United States students who have finished their training and come back, or even are still in training, because they would have that very unique perspective of seeing both worlds, and that could be very helpful. So do you know if we would be able to receive some of their information?
Yeah, we can. Right now in this event, there are a group of people that participate in an umbrella organization which is called National Network on Cuba, who I think will be definitely willing to help you out in reaching these people. You have IFCO Pastors for Peace that I think they have like a record of the students that have graduated and that have come back to the US. So probably it would be better if you deal directly with these organizations.
Okay.
Because when they graduate from Cuba and come to the US, we obviously do not keep track of them.
Sure. Well, we can reach out to you to try to get that information. That would be very helpful. I think we're about to the point of finishing up the questions. I did have one question that was different than some of the others, that had to do with discrimination against LGBTQ folks. Still a problem here in the United States. That is a big political issue, and the person who asked the question had visited and understood that it was somewhat of an issue. And so if either of you could speak to that question.
Yeah, it's in Cuba, it's not an issue at all. Last 2 years ago, at the end of 2022, our country passed on national referendum transcendental code, which was called the Families Code. This is a code that was passed by almost 70% of the Cuban population, was approved by almost 70% of the Cuban population. And basically, it's a broad program, a broad legal judiciary code that consolidates and solidifies the legal and social rights and obligations of the LGBT community, of children, of the elderly. So it's a huge code which comprises of different interesting aspects. ranging from same-sex marriages, to adoption, to issues like divorce, or to issues like change of sex procedures. So, for example, in Cuba, we have more than, you would say, more than 20 years of experience in these specific procedures of changing sex procedures, and there is no discrimination of a sort in these regards. And you know, just have to say, if you wanna find it out on your own, you just have to visit our country. We will be happy to take you to an institution called CNSX, which is an institution that it's an NGO that you know looks after the LGBTQ community, trans rights, different bisexual, homosexual rights, heterosexual rights, cisgenders, transgender. So yeah, it's very important right now. It's a national policy to reach and fight discrimination of all sorts, of gender, of race, of sexual orientation or identification. So yes, I think that would answer the.
Great. Well, you all have just presented a very special presentation from people who are deeply involved in your system. And as you can see from the questions that were answered, we're very interested. And I would say again, many of us would love to visit your country and see the medical system in action and try to think how we could apply those systems of preventive health and universal health care to our system, which is what our goals are. I'd like to ask if either one of you has any additional comments that you would like to share that we didn't ask about before we close up here.
I just want to give you a thank you, because I saw a lot of friends of Cuba that they, with their action, make possible some of these actions that we talk about our health system, healthcare system. We have a complicated situation right now because of all that we explained, but your help and your interest in and your work is really important for us. So thank you. It's just that I want to say.
So thank you, David and Juliet, and thank you to everyone who joined our presentation tonight. There are two, don't go yet though, because we have 2 action items for everyone to take right while you're sitting there. First of all, we want you to sign the petition telling President Biden and U.S. Ambassador to the UN, Linda Thomas Greenfield, to move towards normalizing relations with Cuba and end the blockade. And that's the link for signing that petition's in the chat. And second, we want you to sign the petition to remove Cuba from the state sponsors of terrorism list. That's also in the chat. Or hopefully Anna is dropping the links in the chat. So please click on those links and sign the petitions. My name is Claire Cohen, Dr. Claire Cohen, and I'm the host of The Real McCoy in Healthcare, a podcast about making single-payer healthcare happen in the United States. And I'm hoping maybe David and Juliet, maybe you could be on one of my episodes. We have 4 episodes so far. We're trying to get at least one a month, and you can get them on Apple Podcasts. We're also going to try to have them in our the links in our next newsletter. If you'd like to support our work, please donate to National Single Payer and use the link in the chat to donate. You can also go to our website, www.nationalsinglepayer.com, to sign up for our email list and our monthly newsletters, where you will find registration links for all our webinars and working group meetings. Join us Wednesday, February 28th at 5 p.m. Pacific Time or 8 p.m. Eastern to continue our challenge. What does a publicly owned healthcare system look like? And you can register in advance for this meeting by clicking on the link in the chat, right? And then join us Wednesday, March 13th for our next educational webinar. So thanks again, David and Juliet, for your very interesting presentation. I'm all ready to go to Cuba. It sounds very interesting. And thanks again for being here, everyone, and hope to see the rest of you for the second and fourth Wednesday of the month.
Thank you, everybody.